Hello and welcome to another episode of Fikava Vet Chat. The person I'm going to meet today is one of these people that I love every veterinary surgeon to meet if they are a little bit low, if they are asking themselves, well, why are we doing veterinary medicine? Why is it still the right path for me? We are not really motivated, if we need some inspiration, or if, as I said, we are questioning the job we are doing at the moment. He is a veterinary surgeon from Romania, currently the Fikava director for Romania, and he has also been the president of the Romanian Small Animal Veterinary Medicine. His main subject is urology and nephrology, and all the activities he does and has done in the past, we will discuss as part of this interview. So hello and welcome to Bogdan Alexandru Vitalaru. Hi.
Hey, thank you so much. Thank you so much. This is a great honor for me. And to be honest, every time I am, engaging in things regarding veterinary medicine and Fikava and AMVAC, it's a big pleasure and honor for me. But this is also a personal issue and a personal thing. Being with you and having this interview together gives me like a very big load of emotions. And to be honest, I just missed that because we've done it last year, but it was vice versa. So now I'm the person highlighted, and it gives me some let's say, difficult feelings. I don't know how to manage this. I'm a little bit.
I think you will manage fine. If you don't manage it, do it like me. Sort of have a nice glass of Prosecco.
Yeah, I'm here. I'm prepared. It's a Romanian good wine.
Oh, Romanian white wine, or is it also a Prosecco, something like that?
No, it's white wine, but it's. I cheated a little bit. I have some sparkling water as an additive.
Yeah. That's good. Alex, we both still have a task to fulfill, and that is to go hiking in the mountains in Romania. And last year was not the best year for that, but it's still on my list of things that I want to take off. Because I think you're one of the people, whenever I meet you, it's just absolutely no problem to start talking. I always walk away suddenly with 2-3 centimeters taller, and sort of encouraged just to become better, to learn more in veterinary medicine. And you are, for me, sort of one of these people I love to sort of be together with on a mountain hut, without any radio, without any internet connection or something, like just somebody to talk. And because it's just so easy, and it's yet also so entertaining. And so what shall I say, sort of for me, there's just so much of a knowledge gain whenever I've sort of had a chat with you.
Well, to be honest, I just can't wait for those moments. I have been cheating in the last months, so I've been doing all the proper arrangements. So all you need is a direct flight to Bucharest. The other things are already done.
Okay, that's fine. Well, at the moment of the time of this recording, we're still not allowed to leave the UK, and that's where I am at the moment. But we'll see over the summer. There will be more countries that will hopefully open up, and then
hopefully yes, yeah, hopefully.
But let's talk a little bit about veterinary medicine, and that's I think sort of what it's about. With you, how was that? How did you get into veterinary medicine? Is your background veterinary family?
I have no other relatives doing veterinary medicine, so it was like really simple, because I started thinking about being a vet when I was in the 5th grade, so really young. At 10 years old, I was already decided to become a vet. Well, when I was asked for the first time in my life, what do you want to become when you're going to grow up? I said, I want to be a vet. To be honest, and that was in the English class. And to be honest, my professor had no idea what a vet is, because there was no word like vet in Romania for the moment. It was kind of a veterinarian or animal doctor. And I said, I want to become a vet. And she said, what's a vet? Well, a doctor for animals. She said, why? And I said,
Okay.
because that's really nice. And well, I wasn't aware of how nice it will be, but it is really nice, but it's also demanding. To be honest, it is a really difficult job, but it's a full-time job, and I really enjoy it. So I started young.
Yeah. So you then studied at the University of Bucharest.
Yes, University of Bucharest.
Qualified 2004, and
yep.
then
PhD
and then
2009.
Yeah.
And I've been university assistant for like around almost 10 years, and then assistant professor and associate professor since 2020.
And then I saw you started being a visiting professor at universities in Italy, in Poland, in Croatia. How did this come about? I mean, I find that absolutely
that's a dream came true, because I've met amazing people all over the world, and I had the huge honor to be invited at the Pisa University. There are some amazing people there, like Ilaria Lippi and Professor Grazia Guidi, and I just simply received an invitation letter to be part of the nephrology master. And I said that should be a joke. And that started 2017. And I had amazing moments during those times, of course, until COVID. And then from Pisa, it was Perugia as an Erasmus professor, Erasmus teaching program. And then I was invited for some nephrology classes there. And then I was invited in Croatia. And then in Zagreb University, and then in Poland, in Lublin, with the VetC program, which I'm planning to be more involved in, because that's an amazing program. And of course,
that is where you probably also then met one of our other interviewees, Magdalena Krańska.
Yep.
Because Mm-hmm.
And I've met some great people there, and some great vets, and we continued doing these exchanges. And then, of course, with Zoe, we've done some great things in Thessaloniki University. And I'm, going to continue this thing with the universities. But now I'm really more keen to improve my nephrology and urology clinic, which is taking a lot of my personal time, to be honest. Mm-hmm. We're doing a lot of dialysis, and both hemodialysis and peritoneal dialysis, where I'm going to start, let's say, kind of an internship thing with Romanian vets, try to develop more and more the nephrology and urology in Romania, because I'm pretty positive that our profession needs this to be more than it is for the moment, to be more developed than it is in the moment. Because I've seen a lot of let's say vets doing cardiology, neurology, dermatology, parasitology. And I'm pretty sure that we need also both kidneys to be well and to be safe. And that takes time, and takes a lot of involvement and a lot of work.
Well, I'm a little bit more leaning towards surgery rather than to internal medicine. So I mean, reading through your book, for example, on peritoneal dialysis was for me again sort of what shall I say, tour de force through internal medicine, and I think it was a great read, and for me something I need to back up on this on a fairly regular basis. But then, I mean, when I speak to my clients about sort of internal organs, I always say sort of, well, the liver is a pretty tough old boot of an organ. It takes a lot of beating. It can repair itself even with 10% of the remaining liver tissue. Sort of, you sort of get by, not a perfect, but in any case, sort of the liver is tough. Whereas the kidneys, they're just such a, what shall I say, complex organ. They don't repair themselves. They, if you have some kidney damage, it's very often sort of permanent damage. Then the remaining tubuli in the kidney and glomeruli, they need to do take over the workload from the others which are no longer functional. So because of that, really look well after your kidneys, and obviously if the kidneys are damaged, if you have a patient where the kidneys are damaged, I mean sometimes due to poisoning or old age or so, it's very limited options what one can do. Obviously you are with performing hemodialysis, you are stretching this, and we might talk then a little bit more about that, but I think is my assessment of these, a comparison of these two organs, something you can relate to, or how would you see that?
You know what's amazing? You can sometimes try to substitute the kidneys or try to help them by improving the lifestyle and the management and the food, and then try to invent a new kidney. So you can invent a new kidney in some different ways. You can use the intestines, so you can do like intestinal dialysis. So we have some probiotics that will help to eliminate the urea from the intestines. So you can do some intestinal dialysis, or otherwise you can do peritoneal dialysis, which is a little bit of surgery plus a lot of techniques and internal medicine, of course. And it's all about volumes and numbers and temperatures and liters and calculations. And that's fun because you just do some calculations and in and out and try to lower the urea. And of course, it's all about phosphorus and calcium. And that's technique, and that's you can learn that. But the first part is surgical, so that's nice. There's where internal medicine and surgery, they come together. And of course, when you place the central venous catheter, there's also some small surgery there. And then of course it's hemodialysis, which is an amazing substitute, but you cannot do that forever in dogs, unfortunately, because you have the problem with the venous access, and of course it's also the money, which is another big problem. But when we talk about peritoneal or enteral dialysis or hemodialysis, these are also amazing techniques, and you can do a lot of tricks, starting with the food and supplements and decreasing phosphorus and try to improve the body pH, and that's really nice when you manage a difficult case. I have a 19-year-old cat that I take care of. The owner is a vet, so it's also a personal thing. And we started when she was 17, and she will be 20 years old in July. So if we manage to keep her alive for 2 more months, that will be a 3-year survival at a 17-year-old cat, which is amazing. So you give them some hope, you give them some time, some extra time, and that's really valuable time for the owners. And that's what we're doing. Of course, I also do surgery because I do urology, but now the modern medicine tries to save as many nephrons as we can, and less scalpel, more results. So the minimum invasive that you get, the better the results. So we do a lot of endourology these times.
Yeah, it is. I mean, if you see, I mainly do. I'm doing first opinion practice. It's not that high end what you're doing, but I often and this is something I'm charging for actually quite handsomely. I often sort of make an appointment with the clients to talk if we know that the kidneys are very compromised, to talk through all the options which we have on our hands. So, and that is not even going into peritoneal dialysis or into hemodialysis. It's more that we have a look at the nutritional side, and then we have a look at the management side when it comes to pharmaceuticals that are at our disposal. And it's also so that I usually offer, especially sort of with older cats, I always suggest to clients that they give subcutaneous fluids to these cats on a regular basis. And a lot of clients, I mean, it's a very common thing to ask clients to inject. If you, for example, have a diabetic patient, here, obviously, the volume is a different factor, but I find it is in a lot of clients, you can take them on board with that, and it makes a hell of a difference. I mean, this is simple medicine, but it makes a hell of a difference for these patients who are chronically dehydrated because of, for example, a polyuric polydipsic state of renal failure. Mm.
Well, that's another problem there, because we are used to give water in bowls. So we don't know the fact that usually they don't want to drink this water. So basically the cats, they don't accept easily the water which is not moving. So they need a live water. So they need water to be moving and to be really fresh, and that we have devices for. We have those fountains, or otherwise we cheat. We just leave the water, the tap water, running all day long, and the cat will go there and will start drinking because that's fresh water for them. And that usually along with dry food, that goes to severely chronic dehydration. So if you know how to diagnose the dehydration level, and if you know how to manage this dehydration in time, that will be really you'll have a really positive outcome if you inject some fluids subcutaneously. And now I'm really thinking about implementing some subcutaneous ports just for injecting fluids to be easier for the owners. Imagine that you have a 25-kilo dog, so that's not really easy to inject every day some liters of fluids there. For cats, it's a little bit easier. For older cats, it's a little bit easier also. And then is the phosphorus that we have to fight all day long. And of course, the hypertension, the PUPD syndrome, proteinuria. But luckily for us, we have better and better drugs every day. So we have new tools, and we have new supplements that we are using on daily basis. And to be honest, water is one of the most important tools. So we need to measure the water that they drink. We need to measure everything. We also have a favorite brand of water in Romania, and we are really thinking seriously to create our own water for cats.
Okay. Well, what's so special with that water?
Well, it depends.
Yeah, obviously it has to be. So.
It depends. We need some special things like pH, like sodium, potassium, and chlorine levels. Those are really important. Imagine that a cat can drink up to 44 to 66 mLs of water per kilo per day, which is amazing, which is huge. And if it's a PUPD cat, it can go up to 80 or 90 milliliters per kilo per day. So it's 400 milliliters of water for a 4.5 kilo cat. So that's a lot. Imagine if that water has a high level of potassium or sodium or chlorine, these are all toxic for kidneys and for heart also. So we need to manage those levels. We need to manage the phosphorus, the calcium. We can correct the calcium into the water. We can correct the level, the pH level of the water. So if we have we have a partner, and we want to develop this special cat water for our Romanian cats. And that's we will have let's say water for PUPD cats, and we have water for normal cats, and so on.
I mean, one of the part of the protocol in renal failure cat is phosphate scavenging, but that still sort of doesn't necessarily improve, or well, it will not improve the uptake of calcium. And obviously, we need an equilibrium between calcium and phosphate, ideally. So, sort of how to achieve that? What, well, are there any special tricks?
Yeah.
Or what can we do there?
Well, we have supplements. We have a lot of supplements and medicines, and on the market, you'll get a lot of formulas and a lot of drugs, and I really go along really well with calcium-based phosphorus binders, but not all the time, because sometimes you have cats with high calcium and high phosphorus, and they are not the best choice. So otherwise, we can choose sevelamer or lanthanum-based calcium phosphorus binders, which are also good. But the problem is that they are not used in veterinary medicine, and we don't find them so easily, and we have to use the human products, and that's a problem. There are some aluminum-based phosphorus binders, but we don't use them, because basically they've been considered to be more harmful than useful. So I don't use them. Basically, we use some formulas of calcium-based phosphorus binders, which are really, really useful. And we have some of them are in some gel forms, and some of them are fluid. The other one are just dry components, but we don't like them, and we trick them to eat them. Some of them are really palatable, so they kind of eat them freely. If they do not accept them, we trick them somehow. In cats, it's a little bit more difficult, but in dogs, it's easier.
So is this all sort of not possible, sort of one of the tools or the weapons in our arsenal sort of would obviously be peritoneal dialysis? I think this is something, actually, I mean, having done it a few times, I think it's actually not such a huge procedure. If you read up, I mean, on it, I mean, I have, thankfully, here it is. I have your book on it, so I'm well prepared. But nevertheless, so I always think, sort of, also having spoken to quite a few human patients who do peritoneal dialysis on a regular basis to make themselves a little bit more mobile. Because, I mean, if you are only depending on hemodialysis and you want to go on holidays or travel somewhere, it is really complicated for human patients. Where and there, if you have the possibility of peritoneal dialysis, it gives you just so much more freedom and much further reach, sort of, what you can do. And as I said, once sort of the catheters are placed, sort of, and they're working, it's actually phenomenal, I think, what the peritoneum can, in how far it is able to take over the work of the kidneys.
To be honest, it's the third kidney. So we call the peritoneum the third kidney. So we transform the entire cavity into a new kidney. And once you have done everything well, the placement of the catheter, maybe some omentectomy, and you are really sure that the catheter works properly, there are no fluids, no free fluids subcutaneously, and nothing goes wrong, well, the sky is the limit. because now the big companies are releasing some amazing products. We have the over-the-night formulas and with big molecules of sugar, and then we have some fluids which are also offering small molecules of amino acids inside of the peritoneal dialysis fluid. So that's amazing. They feed the patient and they treat him in the same time. And that's really amazing because I've been using them. Of course, we won't use any commercial names here on any brands, but they're amazing formulas.
But these are now human peritoneal dialysis solutions which you use in dogs and also in cats.
Yes.
Can that be used? Yeah. I mean, admittedly, also I have used sometimes saline, sort of just to have something, especially sort of in poisoning cases, to try to bridge the patient over. If we don't have access to these human solutions, what would you say would be the ideal sort of solution out of our sort of freely available veterinary fluid
really
arsenal?
Simple, because that's also in the book. I've been placing in the book a chapter about homemade peritoneal dialysis fluids. So that's a formula there, which is really simple. We have to keep in mind that we need to change the osmolarity of the fluid. So doing that is really important to add some sugar at the formula. So we basically use either saline or ringer solution or lactated ringer, and then we adjust the level of sugar. So in order to reach the 1.5% solution, we just add some sugar to the solution. You have to be really sterile, and the other thing is just keep it for one exchange. So don't prepare a lot of solutions for the entire treatment. Just do it for the next treatment. Imagine that you're using 60 ml per kilo per exchange. So if you have a, let's say, 4 kilo cat, that's a 240 milliliters of peritoneal dialysis solution. So if you have a half a liter bottle, you just use that for 2 exchanges. So that's enough. Just prepare it, really sterile. Now we have these double spikes that we can use in order to exchange fluids from one bottle to the other directly, which are amazing. And of course, you have the 60 cc syringes. You can use them sterilely, and you can combine solutions in order to get your peritoneal dialysis solution. And of course, then you can add some bicarbonate, you can add some extra potassium, or you can add some calcium-based solutions, and you can combine, or antibiotics if you need them. Or we have some special formulas of low molecule amino acids. You can use them directly into the peritoneum in order to increase the level of proteins in the body. Remember that they are small molecules which are harmless to the kidneys, so they will not hurt the kidneys. So they're safe for the kidneys, and these solutions are especially used in dialysis patients, and they're really nice.
And I mean, now to sort of move on from possible first opinion practice to the specialist practice, I mean, with peritoneal dialysis, how far can I take it before I have to consider hemodialysis? I don't know, what is the longest you have maintained a patient just on peritoneal dialysis before you said, well, it's just not an option any longer, we have to think further or euthanasia?
We have a cat, and there were like 14 months of peritoneal dialysis, and that was amazing. Wow. And I have all the documents.
But obviously, how often did you have to change the catheters?
We changed the catheter twice in this period. Once because the cat just took it out.
Yeah.
And second, because we had some communication problems and the catheter was blocked and we had to reposition it. And we've done it under ultrasound guidance, and it was really simple. And in dogs, my longest patient was around 3 months. I only do that for chronic kidney patients which are really stable from other points of view. And usually I use peritoneal dialysis in small dogs and in cats when we deal with acute kidney injuries. Especially in Romania, we have intoxications or we have babesia, and we treat them. So that's how we try to treat them. And of course, we have some medicine poisoning, some let's say iatrogenies when they use different substances like, I don't know, antibiotics or NSAIDs or other drugs, and we need to treat them. And we've been using this like ibuprofen intoxication in dogs. We've been using peritoneal dialysis in small dogs, and we had a lot of positive outcomes.
So then taking this step to hemodialysis, I mean, that is something, this is an area, I probably mentioned that before when I have had the vet chat with Magdalena, that this is something I think where Eastern Europe possibly, that appears the way it appears to me, probably has the edge. It might be also an ethical issue, because I think in the West there might be some concerns about sort of doing ongoing hemodialysis on patients, in how far this is sort of the right thing to do. But I mean, there's hardly anybody who has more experience on that subject than you. So when do you decide so it's the right time to do this, and how does it work with the patients? I mean, I've never seen it done. I again have spoken to people who do that on a regular basis, sort of as a human patient. But how is that with your veterinary patients?
Well, it is a little bit different because we're using hemodialysis usually from the beginning. We do not switch them from peritoneal dialysis to hemodialysis. So we usually have a long talk with the owners. Yeah. To be honest, almost all the decisions are financially based. So of course, peritoneal dialysis is a little bit cheaper and hemodialysis is a little bit more expensive. If we talk about peritoneal dialysis, the access is better and you can, use it for a longer period. If we talk about hemodialysis, we have some issues. Still, we have some issues with the central venous catheter. So if we need to use them a little bit longer, we will have some problems with blood clotting at the catheter level. So that's important for the moment. We have done it, the longest case that we have done hemodialysis in, it was, I think, around 1.5 months. And we had to change the catheter twice. And then, the fun part, it was that dog became a chronic stable patient and we stopped. And we were able to manage the renal disease just by diet, supplements and injections, and that's it. But that's an exception, because the longest one after that, it was like 3 weeks.
Yeah. So really, you do that still as a procedure to bridge over the renal failure. It's not a permanent solution.
Not a permanent solution, and usually we need to gain some time for the nephrons. Yeah. So we need to have some, let's say, support for those 14 to 21 days when the nephrons are trying to catch up and repair themselves and just let the cells kind of remake the entire pavement and redo the entire epithelium. And that's what we're trying to do, to get some time for the nephrons to repair. That's important. We need to support the patient needs for those 14, 21 days. And that's really important to know.
Do you use then, obviously, I mean, it will be human hemodialysis machines. So do you get them secondhand from hospitals, or how does it work? Or do you buy them new, or how does it work?
Well, we are fortunate because we are, let's say, we have some good relationship with some companies, and they offer us the entire support for our machines, and they do a lot of let's say a lot of work for free for us. So we have a lot of service and technical support, and we have a lot of people which they also love animals a lot, and they are really happy that they're part of this thing, and they help us a lot. And we have some human doctors helping us also, because they also have dogs. And to be honest, one of the most famous nephrologists, human doctors in Romania, he had his dog on dialysis with us, and that was an amazing experience, because he had all this huge load of knowledges from human medicine, but when he came up with this situation face to face with his personal dog, with his favorite dog, because he had 3, and well, the entire medicine went down. So he was like a student, like a vet student in the first year, asking questions. And I said, look, professor, you're teaching that, so we have to try to develop all this mechanism. And he said, well, this doesn't look like medicine anymore, because this is my animal, and that's different. And well, we've done things together, and we've learned a lot of things from him, and that was at the beginning of our journey, and we are still really close friends, and he comes and visits us, and we have a good relationship with human doctors. That's basic.
It reminds me a little bit on the beginning of veterinary dentistry, where sort of we quite often sort of work together. I remember sort of doing a general anesthesia on a German Shepherd up in North Norway, when I took the dog sort of to the local dentist, and he was doing a couple of fillings, I think, on the teeth of a dog. I mean, we're talking many years ago or so, but for him it was so interesting sort of to have different sort of teeth to deal with, and for me it was very interesting to see sort of how his technique was to do the fillings, and what sort of tools he had at his disposal. Obviously, I mean, now we have moved on, and there's no longer quite the need for that sort of. I mean, people like Peter Farnkrug or Jerzy Gabor and Anemice, they have really moved it and pushed it sort of forward. So, but it's possibly sort of in a similar level. Obviously, when we talk about sort of renal failure, we can't really miss out on on talking a little bit about renal transplants. Is that something you are allowed to do in Romania? Is that something you have performed? Where are we there? Well, I know that in the States they have, I think, done that. In the UK, we are not allowed to do so. But how's the situation in Romania?
It's less about being allowed. I think it's more than being able to do that and looking forward for the benefits of it. I am not sure we still have some benefits doing that. So I have a colleague that has started doing auto transplant. So he tried to get the kidney out from the patient and put it back in the same patient, and it was just for scientific things.
Okay.
Well, I'm not sure we are going to be able to do that in, let's say, next year. I think it will be really beneficial to try to do that in the next years, but we have a lot of things to take care of, like blood typing, autoantibodies, antibodies, a lot of things connected with, let's be honest, some disease that you don't test for. And of course, we also have another big problem, the size of them. And, you know, you have to find the proper size of the kidney. Because, well, to be honest, if you have...
Okay, in a dog, yes, yeah, possibly, yes, yeah. Because I saw in a cat, and they're all roughly the same.
Problem. They're almost the same. But in dog, you know, if you have a 2-kilo dog and a 45-kilo dog, that's not the same thing. So we have let's say, some problems, and I think one of the most important one is the immunological one, and that should be our first concern. And then, of course, it's all about, you know, being politically correct and medically correct, and that's another problem.
It's also a matter of consent. So I mean, we don't have here somebody who can give an what shall I say, an educated and consent. Okay, fine, I'm donating my kidney. You have to see, okay, where do you get the donors from?
Yeah.
So I mean, one project I heard of in the United States was that they did that in cats, where they used shelter cats, and it was so that the recipient of the kidney had to adopt this
cat. Yeah.
To have some sort of but it is obviously, I mean, it's a minefield. It's an ethical minefield. Is that correct? Still, the everybody you speak to who has donated a kidney it tells you that you don't feel good afterwards. You have a rotten time because the remaining kidney takes a moment time to adjust to it, and the donor, the recipient, feels great, but okay, they have post-operative pain, but otherwise they feel fantastic. Suddenly they can go to the toilet again and everything's great. And the donor is not in for a good time, but obviously, I mean, it's transient.
The other solution that I'm thinking about, it's the medical printing and the 3D printing. I'm not sure they're going to reach the level of improving all the functions of the kidney, but looking and analyzing all these progresses that the technology has been acquired in the last years, I'm pretty positive that in some time there will be some huge steps there. So I think that would be a better option, in my opinion.
Yeah.
With some stem cells from the recipient and some new technologies, I think we can, you know, have some amazing outcomes, but we'll see that in time.
Wow, that was really a nice sort of walk through the whole thing. I will tick that off as an hour of CPD, you know that. As I said, sort of whenever I talk to you, I always learn stuff, and it's just great. So what are you up to now? I heard sort of obviously, I mean, you have been lecturing everywhere. Sort of you have a huge online presence because obviously of COVID. What are your projects now?
Well, to be honest, I'm 100% focused on AMVAC, and of course we need to let's say, readapt to the new life of veterinary medicine in the society, and we're waiting for the opening, the new life and things. And together with the AMVAC team, we are, you know, thinking about new projects. Of course, the Congress is off, so we are thinking about replacing the Congress with some online events because this is a little bit way better. And of course, I'm doing some online teaching, but to be honest, I'm kind of trying to, let's say, have a break, because having a break is good. And I need some time for myself, and I need some time to be off the scene, and that's a little bit better this way. And I'm 100% focused on my clinic and on AMBAC. So this is what I'm doing now, and of course I'm preparing some mountain hiking for summer. And we have a vet camp that we're usually.
I know. Our mutual friend Robert Popper he told me much about it, and Juana and Robert they took part in that, and they said, Wolfgang, you have to come along. And
I am already preparing the fourth edition, so we have some beautiful mountains to see. So.
I think you should not just make that an AMBAC thing. You should make that an international mountain camp. Then international mountain camp in Romania, and then maybe, you see, my local colleague here, Noel Fitzpatrick, he does that every June, that he does his vet festival. There's a combination of an outdoor event, you bring along your tent, and he and a lot of his specialist colleagues give fantastic lectures. Then they have a rock concert on the Saturday night. It's an amazing event. It's really fantastic.
That's a good thing.
And I think you should do something like that in Romania. I think it would be.
That's a good thing. Good idea.
Event.
We can do that.
There we go. So if it takes off, I have the copyright on it. Oh man, that's great. Alex, thank you so much for this great vet chat. As I said, I learned a lot, and I'm pretty sure that a lot of our listeners and viewers have learned a lot as well. If you would like to comment on this episode of Fekava Vet Chat, or if you have suggestions for future vet chats, please email us on vetchat@fekava.org, or use our social media presence to leave some comments. Thank you very much, and I'm looking forward to seeing you all at our next episode of Fekava Vet Chat. Good night.
Good night.